Hi, my name is Dr. Alina Fong. I am a clinical neuropsychologist and I am a co-founder of Cognitive Effects. Today I'm going to do an audio read of one of our most popular and most read blogs called How to Treat a Concussion with Active Rest, Active Therapy, and Diet Changes, and more. If you ever visit a doctor for a concussion, you might be told to lie down in a dark room until all your symptoms go away. Many doctors learned that rest was the best way for patients to heal safely from a concussion, but that is no longer best practice. In fact, research shows that active management of concussion has better outcomes. And in our experience, treating thousands of patients, many of whom had symptoms that lasted for months or years, we know that resting until you feel better can be very frustratingly ineffective. Fortunately, there is another way. In this blog about treating a concussion, we will answer commonly asked questions and share our findings after years of research in treating patients. We will cover how to know if you have a concussion, different signs and symptoms, how doctors treat a concussion, how to treat a concussion at home, what to do about concussion headaches, how to treat a concussion in children, what not to do after a concussion, and what to do if your symptoms still don't go away. As you'll see, there is a lot more you can do to recover from a concussion than just cocooning and lying around in bed all day. A concussion is the same thing as a mild traumatic brain injury, or MTBI. You don't have to receive a blow to the head to get a concussion. A concussion may occur whenever you receive a hit, or maybe you're shaken, or receive a jolt to the head. For example, if your car stops suddenly, your brain might be jarred enough to hit your skull. If it does, that jostling is enough to cause concussion symptoms. If you have any of the common symptoms of a concussion listed in a checklist that we created, and you received a known bump or shake to the head, then you probably have a concussion. You can learn more about concussion symptoms, when they appear and disappear, and why in our guide to the symptoms of a concussion. In general, it's best practice to see a healthcare professional when you sustain a suspected concussion. But if you or someone you know is experiencing the signs of severe head trauma, seek medical care at an emergency room immediately. And here are the signs that you should head to the ER. Number 1, abnormal behavior. Number 2, clear fluid coming from the ears or the nose. 3 is confusion, difficulty recognizing people or places, or agitation. 4 is differently sized pupils. 5 is drowsiness or difficulty waking up. 6 is a loss of consciousness. 7 is loss of feeling in part of the body. 8 is memory loss about the time of the injury or what followed. 9 is persistent, severe balance problems. 10 is seizures. 11 is severe weakness. 12 is severe worsening headache. And 13 is vomiting more than once. While concussion severity is not linked to causes of concussion, it's also good to seek medical attention at the emergency department if your injury happened at high speeds, such as a motor vehicle accident, or if you're taking medications that could increase bleeding, such as anticoagulants. Otherwise, most concussions can be treated at home, at least for the first 3 weeks. If after 3 weeks your symptoms haven't resolved, you'll need more targeted concussion treatment than you can receive at home. What to do after a concussion? What you do after a concussion depends on the severity of the head injury. If you have significant bleeding or any of the emergency symptoms that we listed above, you should see a healthcare provider immediately. But if you're not in immediate danger, then you have a choice. You can visit a doctor or a concussion clinic to get an official diagnosis and personalized guidance, or you can try to treat the concussion at home. And here's what to expect in either situation. How doctors typically treat a concussion. What kind of concussion treatment you receive varies greatly based on what type of provider you visit and what diagnostic tools they have available. Most primary care and pediatric doctors don't have the resources in-house to provide treatment, but they might be able to refer you to a therapist for post-concussion care. If you visit the ER, you're more likely to receive a CT scan or potentially a structural MRI. While these scans cannot detect a concussion, they can identify more serious injuries such as a skull fracture, brain bleeding, or more. But there are many other medical providers capable of diagnosing and treating a concussion if you know where to go. Sports medicine physicians, therapists, physical medicine and rehabilitation physicians, or PMNR doctors, or also physiatrists as they're known as well as others, if they specialize in concussion, can provide active care as you recover. Concussion healthcare varies from doctor to doctor. If your symptoms don't clear within 2 weeks, look for someone who can provide active therapy, like our sister clinic here in Provo called Neural Effects, which focuses on acute concussion treatment. They have a list of therapies that can help you heal faster from a concussion. How to treat a concussion at home. For the first 2 days after a concussion, practice relative rest. Don't hide or cocoon in a dark room all day, but do avoid strenuous mental or physical activity. Gentle activities such as sitting in a shady garden, light reading is tolerated, stretching, art projects, and the like are fine as long as they don't produce a sharp increase in symptoms. Potentially avoid bright lights, loud noises, and crowded environments as much as possible in the first 2 days. But after those first 2 days, exercise and cognitive stimulation are essential to concussion recovery. When you get a concussion, there is an initial period of inflammation and a temporary breakdown of tiny structures in and around the brain cells at the site of your injury. Because of that, the affected cells experience dysfunctional signaling when they call for oxygen and other micronutrients as they attempt to perform their tasks. Often, these neurons don't successfully complete the cognitive processes like seeing, thinking, or reading that they were trying to achieve, or it takes them far more resources than usual. Other neural pathways can pick up that task, but it is harder on your brain. Ideally, your brain will return to normal, more effective neural pathways when inflammation goes down. Unfortunately, that doesn't always happen, and when it doesn't, patients can be left with lingering symptoms for weeks, months, or even years. Physical exertion and cognitive exercise in reasonable quantities can decrease recovery time and increase your chances of healing properly. Here is the specific regimen we recommend. Number 1, do cardio for about 30 minutes a day or as tolerated. Now, do not do any exercises that would result in jostling your head. For example, you shouldn't go for a run as your cardio workout. If you have access to a stationary bike or an elliptical machine, those are ideal for getting your blood pumping without making your concussion worse. If you don't have access to exercise equipment, do your best to get your heart rate up with calisthenic exercises. If you have any dizziness or difficulty balancing, switch to something that does not aggravate your symptoms. Now, if you can't make it 30 minutes without a sharp increase in symptom severity, such as dizziness or headaches, do intervals. For example, get in a minute or 2 of intense exercise, then sit down and breathe in a set pattern. We recommend 4 seconds in, 1 second hold, and 6 seconds out. When your heart rate comes down, start another interval. Do whatever you can manage. Physical activity once a day makes a big difference in healing. Number 2, immediately after exercising, engage in cognitively demanding activities. Exercise produces an increase in helpful neurochemicals such as BDNF, or brain-derived neurotrophic factor, and has been shown to increase cognitive flexibility. That means cognitive exercise after physical exercise is more effective. So try reading a book or having an intellectually demanding conversation with someone, or choose one of these cognitively stimulating activities that you can do at home. You can take breaks as needed, but do your best to exercise your brain for roughly 30 minutes. Third, calm your autonomic nervous system. Your autonomic nervous system, or ANS, which controls the processes in your body that you don't think about, can be impacted by a concussion. Thanks to autonomic nervous system dysfunction or dysautonomia, your post-concussion breathing patterns might change. You could have heartbeat irregularities, and you might feel more stressed or anxious. ANS dysfunction can contribute to most common concussion symptoms, including headaches, vision problems, personality changes, and more. While alternating between cardio and controlled breathing can help, it's also good to relax in any way you can. Some people turn to meditation or prayer, soothing music, yoga, and other calming activities to ease the strain on their ANS. There's also an app called Brainwave 35 Binaural Series that can help. As you recover from acute concussion, plan to spend most of your day resting. Number 4, resting from screens and try to do some normal activities if you can. Now, this part of traditional concussion advice is good. If you can, give the electronics a break. That's not to say that you can't have any time in front of screens, but you shouldn't spend the whole day playing video games. Exposure to non-screen normal activities will help your brain recover. So during chores, chatting with friends, and even light work or homework could be helpful. Remember to rest in between these activities as needed. Number 5, return to work or school gradually. If at all possible, follow a gradual return to your normal daily activities. Be it your job or schoolwork, try to start at 10 hours your first week back, and then try 20 hours the following week. By gradually working your way up to full-time attendance, you're giving your brain the space it needs to finish healing. Even if you're symptom-free, this step is important if you can make it work. 6, follow a good post-concussion diet. If you're looking for something else that you can do to help your brain heal, consider an anti-inflammatory diet. If that is too much to handle by yourself and you don't have someone to help you in the kitchen, maybe focus on these changes. A, reduce your intake of processed foods, such as refined sugar, as much as you're able. B, drink enough water. To calculate the daily water intake you may need, divide your weight in pounds by 2. That's how many ounces of water you should drink per day. For example, if you weigh 200 pounds, aim to drink about 100 ounces of water per day. C, add fresh vegetables, fruits, and nuts to your diet as often as you can. And D, eat regularly. 6 small meals per day or 3 normal-sized meals. Above all, make sure you eat regularly. How to treat a concussion headache. Headache is the most common post-concussion symptom in our patients. One study found that well over 50% of patients experienced post-traumatic headache after a mild concussion at various points during the study, and over 30% experienced persistent headaches. If you have a headache right after the concussion, it's usually safe to take Tylenol or acetaminophen during the first 48 hours after injury because it does not increase the risk of brain bleeds. After that, you can take other over-the-counter pain medicines such as Advil, Motrin, ibuprofen, Aleve, etc., to reduce your pain while you recover. Follow the directions on the bottle suitable for your age and never take more than the maximum dose without a doctor's approval. Now that said, natural methods of relaxing and massage, as mentioned in the video included in this article, can be safer and more effective than the medications. For a severe headache or migraine that isn't controlled by over-the-counter pain medicine, you may need to seek medical advice. You can also read our other article about post-concussion headaches and take our online course about relieving post-injury headache pain. How to treat concussion in children. While all the advice applies to children as well, it can be difficult to put into practice depending on the age of your child. Since adolescents are old enough to listen and follow instructions, you can help them with their daily physical and cognitive exercises. Listen to their feedback. If they're in too much pain or getting overwhelmed, help them calm down. It's important for their autonomic nervous system to recover in a low-stress environment. For young children, concussion follow-up care is more difficult, so do what you can to protect them from falls and encourage them to rest as much as possible. If you can get them to solve some puzzles or play some games, that's great. You may need to work with your family physician to set up a more realistic care plan. If your child suffered a sport-related concussion, then you may also need to coordinate with their coach on a plan to return to play. The Centers for Disease Control and Prevention, or CDC, have resources for return to play via their Heads Up program, though we encourage earlier supervised aerobic activity in keeping with current research. What not to do after a concussion. What are some things you should avoid while you heal from your concussion? Well, don't push yourself to do more than you can handle. Don't rush your recovery, and don't return to sports or work environments that put you at risk for another concussion. So here is the most important rule of recovery. I will repeat: do not engage in activities that put you at further risk for another concussion. This holds true for athletes in any sport, but especially for athletes who play contact sports. Whether you're recovering from a mild TBI, your brain needs time to heal. Your symptoms may affect balance, coordination, and other skills necessary for staying safe while you practice. You're more likely to get another concussion when those abilities are compromised. Even if you're the kind of person who would push your limits with other sports injuries, don't put your brain at risk. If you get a second concussion while recovering from the first, you risk longer-lasting symptoms and brain damage. And in extremely rare cases, some patients die from a rapid swelling reaction in their brains, a life-threatening condition known as second impact syndrome. Given the possible consequences, it is never wise to engage in activities that put you at risk for a repeat concussion while you're healing from the first. It's also best to avoid screen time whenever possible, but limited time in front of the TV or your phone is okay. How long does it take for a concussion to heal? The majority of concussions heal in the first week or two after injury. Many recover within 7 to 10 days. However, full concussion recovery can take up to 3 months. If concussion symptoms persist longer than 3 months, then a post-concussion syndrome diagnosis is likely. In that case, patients need specialized treatment. You can speed up your concussion recovery by following guidelines for at-home recovery and by going to therapy appointments. What to do if concussion symptoms persist, thereby meeting the criteria for post-concussion syndrome. Now, for most concussions, symptoms should resolve within 2 weeks. In some cases, it may take up to 3 months for full recovery. Unfortunately, not all concussion symptoms resolve within those time frames. Sometimes it takes additional treatment to repair the communication pathways in your brain affected by the concussion. If you experience persistent post-concussion symptoms, you will likely not recover without specialized targeted therapy. At Cognitive Effects, we offer an intensive therapy regimen that we custom build around the needs of each patient. After a battery of testing to evaluate your brain, the autonomic nervous system, vision, and vestibular functioning, including a form of fMRI known as FNCI, we'll know which of your brain areas and body are affected and in what way. That allows us to tailor physical training, cognitive drills, and emotional and cognitive therapy to your specific needs. Using our FNCI, or our version of fMRI, we see evidence of how your brain changes with treatment. Using that information, in addition to our therapist's evaluation of your progress, we send you home with a concrete plan to continue improving. Some therapies we use include physical and neuromuscular therapy, occupational therapy, cognitive therapy, sensory motor therapy, vision therapy, vestibular therapy, psychotherapy, and more. You can also hear from past patients about the experience they had with our recovery program. You could hear about Olivia, who is a former figure skater who found our clinic over a decade after her injuries, or Anthony Lubey, an attorney who feared he could never practice law again after his car accident, or Nate Benson, a neuroscience student who suffered brain damage from carbon monoxide poisoning, or Sam Pempleton, a student who tried every concussion clinic she could before finding Cognitive Effects, or even Chris Nicastro, whose wrestling concussions postponed his college plans. Many patients are told that their symptoms are incurable, or worse, they're told to stop faking their symptoms and get back to work. But your symptoms are real and they are treatable. 90% of our patients show symptom improvement with just 1 week of treatment. To discuss your experience and determine your eligibility for treatment, sign up for a consultation with our team. Thank you for your attention.